Question 1. Which first-line antitubercular drug is most associated with optic neuritis? A. Isoniazid. B. Rifampin. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: ethambutol can cause optic neuritis leading to decreased red-green color discrimination and visual acuity. Strategy: associate for eyes with ethambutol. Always think about eye exams for patients on this drug. Question 2. A patient on isoniazid therapy develops peripheral neuropathy. Which supplement prevents this complication? A. Vitamin C. B. Pyridoxine, B6. C. Vitamin B12. D. Niacin. Answer: B. Pyridoxine, B6. Rationale: isoniazid competes with vitamin B6 and can lead to neuropathy. Supplementation prevents it. Strategy: remember isoniazid interferes with B6. Question 3. Which TB drug is hepatotoxic and can cause orange discoloration of body fluids? A. Rifampin. B. Isoniazid. C. Streptomycin. D. Ethambutol. Answer: A. Rifampin. Rationale: rifampin is a potent inducer of liver enzymes and causes orange tears, urine, and sweat. Strategy: think R for red/orange fluids. Question 4. Which drug is contraindicated in gout patients due to hyperuricemia risk? A. Rifampin. B. Pyrazinamide. C. Ethambutol. D. Streptomycin. Answer: B. Pyrazinamide. Rationale: pyrazinamide can increase uric acid levels, worsening gout. Strategy: remember P for pain in joints. Question 5. Which TB drug is an aminoglycoside and can cause ototoxicity? A. Isoniazid. B. Streptomycin. C. Rifabutin. D. Ethianamide. Answer: B. Streptomycin. Rationale: streptomycin is nephrotoxic and ototoxic. Strategy: think S for sound loss. Question 6. When giving rifampin, which patient teaching is most appropriate? A. Report orange urine immediately. B. Expect orange body fluids, this is normal. C. Avoid drinking milk. D. Take with antacids to prevent GI upset. Answer: B. Rationale: orange body fluids are expected and harmless. Strategy: always distinguish between harmless versus alarming side effects. Question 7. Which combination forms the standard first-line anti-TB regimen, RIPE? A. Rifampin, isoniazid, pyrazinamide, ethambutol. B. Rifampin, isoniazid, prothionamide, ethianamide. C. Rifabutin, isoniazid, PAS, ethambutol. D. Rifampin, isoniazid, cycloserine, kanamycin. Answer: A. Rationale: RIPE is the standard 4-drug regimen for active TB. Strategy: memorize RIPE equals rifampin, isoniazid, pyrazinamide, ethambutol. Question 8. Which drug causes a lupus-like syndrome as a rare adverse effect? A. Isoniazid. B. Rifampin. C. Clofazimine. D. Ofloxacin. Answer: A. Isoniazid. Rationale: INH can induce drug-induced lupus erythematosus. Strategy: remember isoniazid induces lupus. Question 9. What baseline test is crucial before starting ethambutol? A. Liver function test. B. Audiometry. C. Visual acuity and color vision test. D. Creatinine clearance. Answer: C. Rationale: ethambutol may cause optic neuritis. Baseline eye exams are necessary. Strategy: think eye test for ethambutol. Question 10. Which of the following leprosy drugs can cause skin discoloration, red-brown to black? A. Rifampin. B. Clofazimine. C. Dapsone. D. Ethianamide. Answer: B. Clofazimine. Rationale: clofazimine deposits in skin causing discoloration. Strategy: think clofazimine equals color change. Question 11. Which anti-leprosy drug can cause hemolysis in G6PD deficient patients? A. Clofazimine. B. Rifampin. C. Dapsone. D. Ofloxacin. Answer: C. Dapsone. Rationale: Dapsone causes oxidative stress hemolysis in G6PD deficiency. Strategy: think Dapsone destroys RBCs in G6PD deficiency. Question 12. A nurse monitors liver function tests monthly for a patient on TB treatment. Which drug is most hepatotoxic? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Pyrazinamide. Rationale: pyrazinamide is the most hepatotoxic among first-line drugs. Strategy: remember P for potent hepatotoxicity. Question 13. Which drug requires monitoring of uric acid levels? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: C. Rationale: pyrazinamide increases uric acid monitor for gout. Strategy: link P to painful joints. Question 14. A client taking isoniazid and rifampin reports jaundice. What should the nurse do first? A. Reassure that this is a normal effect. B. Continue therapy and monitor weekly. C. Notify the provider immediately. D. Discontinue ethambutol. Answer: C. Rationale: jaundice indicates drug-induced hepatitis potentially life-threatening. Strategy: always prioritize safety, stop hepatotoxic drugs and report. Question 15. Which drug is used as a single-dose therapy for leprosy in single-lesion cases? A. Clofazimine. B. Rifampin. C. Dapsone. D. Minocycline. Answer: B. Rifampin. Rationale: single-dose rifampin is recommended in single-patch leprosy. Strategy: think rifampin equals rapid single shot. Question 16. Which drug is a strong inducer of CYP450 enzymes, reducing the effectiveness of oral contraceptives? A. Isoniazid. B. Rifampin. C. Clofazimine. D. Dapsone. Answer: B. Rifampin. Rationale: rifampin induces hepatic enzymes, lowers levels of oral contraceptives, risk of pregnancy. Strategy: teach patients to use non-hormonal contraception while on rifampin. Question 17. A patient on rifampin complains of flu-like symptoms after missed doses. What is the best action? A. Reassure and continue medication. B. Stop rifampin immediately. C. Give antihistamine. D. Switch to rifabutin. Answer: B. Rationale: flu-like syndrome after interrupted rifampin therapy may indicate hypersensitivity. Discontinue drug and notify provider. Strategy: never restart rifampin abruptly after missed doses. Question 18. Which drug is contraindicated in pregnancy because of risk of fetal ototoxicity? A. Rifampin. B. Streptomycin. C. Clofazimine. D. Ethambutol. Answer: B. Streptomycin. Rationale: streptomycin can cause congenital deafness. Strategy: S equals sound loss in baby. Question 19. Which laboratory test should be done before and during rifampin therapy? A. Vision test. B. Liver function test. C. Creatinine clearance. D. Audiometry. Answer: B. Liver function test. Rationale: rifampin is hepatotoxic, monitor AST/ALT. Strategy: always think liver monitoring with rifampin plus isoniazid. Question 20. What is the mechanism of action of isoniazid? A. Inhibits DNA gyrase. B. Inhibits arabinyl transferase. C. Inhibits mycolic acid synthesis. D. Inhibits RNA polymerase. Answer: C. Rationale: isoniazid blocks mycolic acid synthesis in mycobacteria. Strategy: I for isoniazid equals inhibits cell wall mycolic acids. Question 21. Which drug is reserved for multi-drug resistant TB, MDR-TB, and can prolong QT interval? A. Clofazimine. B. Bedaquiline. C. Ofloxacin. D. Rifabutin. Answer: B. Bedaquiline. Rationale: bedaquiline inhibits ADP synthase of mycobacteria but causes QT prolongation. Strategy: monitor ECG regularly. Question 22. A patient taking pyrazinamide reports severe abdominal pain. What is the priority nursing action? A. Encourage to continue medication with food. B. Notify the provider. C. Administer antacid. D. Stop all TB drugs. Answer: B. Rationale: severe pain may indicate hepatotoxicity. Must notify provider. Strategy: abdominal pain plus jaundice equals red flag for liver injury. Question 23. Which drug can cause psychosis and peripheral neuropathy as rare side effects? A. Isoniazid. B. Ethianamide. C. Clofazimine. D. Rifabutin. Answer: B. Ethianamide. Rationale: ethianamide, a second-line drug, causes GI upset, psychosis, neuropathy. Strategy: monitor mental health in patients on ethianamide. Question 24. Which drug is used as a single monthly dose for leprosy treatment in children? A. Dapsone. B. Rifampin. C. Clofazimine. D. Minocycline. Answer: B. Rifampin. Rationale: rifampin is given monthly for leprosy as part of MDT. Strategy: rifampin equals rifast cure. Question 25. Which side effect of clofazimine is most distressing to patients but harmless? A. Photosensitivity. B. Skin discoloration, red-brown. C. Hepatitis. D. Alopecia. Answer: B. Skin discoloration. Rationale: clofazimine deposits pigment in skin, causing cosmetic concerns. Strategy: provide psychological support and explain reversibility. Question 26. Which TB drug is contraindicated in severe liver failure? A. Ethambutol. B. Rifampin. C. Isoniazid. D. Pyrazinamide. Answer: D. Pyrazinamide. Rationale: pyrazinamide is strongly hepatotoxic. Avoid in severe liver disease. Strategy: check LFTs before starting treatment. Question 27. Which drug is used as prophylaxis for latent TB infection? A. Rifampin for 2 months. B. Isoniazid for 6 to 9 months. C. Ethambutol for 9 months. D. Streptomycin for 6 months. Answer: B. Rationale: INH for 6 to 9 months is standard prophylaxis. Strategy: isoniazid equals infection prevention. Question 28. Which anti-leprosy drug may cause severe hypersensitivity reaction, sulfone syndrome? A. Clofazimine. B. Dapsone. C. Minocycline. D. Rifampin. Answer: B. Dapsone. Rationale: sulfone syndrome, fever, exfoliative dermatitis, hepatitis. Strategy: stop drug immediately if rash plus fever appear. Question 29. Which drug can cause red-orange discoloration of contact lenses? A. Rifampin. B. Ethambutol. C. Dapsone. D. Clofazimine. Answer: A. Rifampin. Rationale: rifampin stains tears and contact lenses. Strategy: advise glasses instead of contacts. Question 30. Which drug causes dose-related optic toxicity but can be used safely in children? A. Ethambutol. B. Rifampin. C. Isoniazid. D. Pyrazinamide. Answer: A. Ethambutol. Rationale: previously avoided in children, now considered safe with monitoring. Strategy: always assess vision regularly. Question 31. Which drug is bacteriostatic against M. leprae? A. Rifampin. B. Dapsone. C. Clofazimine. D. Ethianamide. Answer, B. Dapsone. Rationale: dapsone inhibits folate synthesis in M. leprae. Strategy: dapsone equals folate blocker like sulfonamides. Question 32. A nurse should avoid giving alcohol with which drug to prevent severe hepatitis? A. Rifampin. B. Isoniazid. C. Clofazimine. D. Dapsone. Answer, B. Isoniazid. Rationale: alcohol plus INH risk of liver toxicity. Strategy: teach absolute avoidance of alcohol. Question 33. Which drug is a rifamycin derivative used for TB in HIV patients to avoid drug interactions? A. Rifapentine. B. Rifabutin. C. Rifamycin SV. D. Rifalazil. Answer, B. Rifabutin. Rationale: rifabutin less strongly induces CYP450 safer with ART drugs. Strategy: rifabutin equals better for HIV. Question 34. Which drug has the unique adverse effect of crystal deposition in joints? A. Pyrazinamide. B. Streptomycin. C. Ethianamide. D. Ethambutol. Answer, A. Pyrazinamide. Rationale: hyperuricemia urate crystal deposition arthralgia. Strategy: advise patients to report joint pain promptly. Question 35. What is the drug of choice for lepra reactions, type 2 erythema nodosum leprosum? A. Dapsone. B. Rifampin. C. Clofazimine. D. Thalidomide. Answer, D. Thalidomide. Rationale: thalidomide is effective in ENL but contraindicated in pregnancy. Strategy: teratogenic warning is crucial. Question 36. Which drug can cause vestibular toxicity, vertigo, ataxia? A. Ethambutol. B. Streptomycin. C. Rifampin. D. Isoniazid. Answer, B. Streptomycin. Rationale: aminoglycosides damage vestibular apparatus. Strategy: monitor balance and hearing. Question 37. Which drug turns urine a red-brown color but is not rifampin? A. Clofazimine. B. Dapsone. C. Rifabutin. D. Pyrazinamide. Answer, A. Clofazimine. Rationale: clofazimine causes reddish-black urine and feces. Strategy: reassure patients that it is harmless but persistent. Question 38. Which drug is contraindicated in patients with porphyria? A. Rifampin. B. Isoniazid. C. Ethianamide. D. Pyrazinamide. Answer, B. Isoniazid. Rationale: INH induces enzymes exacerbates porphyria. Strategy: screen history before starting therapy. Question 39. Which drug causes red man-like discoloration of skin after prolonged use? A. Rifampin. B. Clofazimine. C. Dapsone. D. Streptomycin. Answer, B. Clofazimine. Rationale: clofazimine deposits pigment, diffuse skin darkening. Strategy: counsel patients to expect skin changes. Question 40. Which drug may cause psychosis if given in overdose? A. Isoniazid. B. Pyrazinamide. C. Rifampin. D. Ethambutol. Answer, A. Isoniazid. Rationale: INH toxicity, neurotoxicity, seizures, psychosis. Strategy: treat overdose with 4B6, pyridoxine. Question 41. Which drug has the unique property of sterilizing semidormant TB bacilli in acidic pH? A. Rifampin. B. Pyrazinamide. C. Ethambutol. D. Isoniazid. Answer, B. Pyrazinamide. Rationale: pyrazinamide works best in acidic environment inside macrophages. Strategy: remember pyra equals works in acidic pyro environment. Question 42. Which drug causes reddish sweat that can stain clothes? A. Clofazimine. B. Rifampin. C. Rifabutin. D. Dapsone. Answer: B. Rifampin. Rationale: harmless but distressing for patients. Strategy: teach patients to expect staining. Question 43. Which drug causes retrobulbar neuritis and is dose-dependent? A. Ethambutol. B. Streptomycin. C. Rifampin. D. Pyrazinamide. Answer: A. Ethambutol. Rationale: high doses blindness if untreated. Strategy: early detection is key. Stop drug at first sign of visual change. Question 44. Which drug can cause methemoglobinemia? A. Rifampin. B. Dapsone. C. Clofazimine. D. Ethambutol. Answer: B. Dapsone. Rationale: dapsone oxidizes hemoglobin. Methemoglobinemia. Strategy: treat with methylene blue if severe. Question 45. Which drug causes reddish-brown feces and may cause constipation? A. Clofazimine. B. Pyrazinamide. C. Rifampin. D. Isoniazid. Answer: A. Clofazimine. Rationale: clofazimine causes pigment deposition in intestinal mucosa. Strategy: encourage high-fiber diet to manage constipation. Question 46. Which drug is known to cause hepatitis as a delayed hypersensitivity reaction? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Streptomycin. Answer: B. Isoniazid. Rationale: INH hepatitis may appear after several weeks. Strategy: monitor AST/ALT monthly. Question 47. Which drug is most likely to interact with warfarin and reduce its effect? A. Rifampin. B. Isoniazid. C. Pyrazinamide. D. Ethambutol. Answer: A. Rifampin. Rationale: rifampin induces CYP450 warfarin level clot risk. Strategy: adjust warfarin dose accordingly. Question 48. Which drug is bactericidal against both actively growing and dormant TB bacilli? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: A. Rifampin. Rationale: rifampin sterilizes lesions, prevents relapse. Strategy: key drug for short-course therapy. Question 49. Which drug causes reddish-brown tear staining that is not dangerous? A. Clofazimine. B. Rifampin. C. Dapsone. D. Rifabutin. Answer: B. Rifampin. Rationale: stains tears, saliva, sweat. Strategy: reassure patient, avoid panic. Question 50. Which drug is contraindicated in severe renal failure because of accumulation? A. Rifampin. B. Isoniazid. C. Ethambutol. D. Pyrazinamide. Answer: C. Ethambutol. Rationale: excreted renally accumulation leads to optic toxicity. Strategy: adjust dose based on creatinine clearance. Congratulations! You've just tackled 50 of the toughest NCLEX-style questions on TB and leprosy drugs. Mastering these questions helps you remember not only the drug names but also their adverse effects, contraindications, and monitoring requirements. Keep practicing daily. Success on the NCLEX is all about pattern recognition and clinical judgment.